So what I've shown you right now is a lot of descriptive data and really patient-related data, but of course we are also interested in why is exercise so beneficial, and for this purpose we usually use preclinical trials and animal models, and what I show you here is just an example of many preclinical trials where animals are affected by cancer. In this case here, it was a breast cancer. And what was investigated is here the tumor growth or the tumor size in this study. And you can see that chemotherapy alone and exercise alone has a similar effect. I don't want to say here, and I think that is a completely wrong conclusion, that exercise can replace the medical treatment, in this case the chemotherapy. That should not be the conclusion. The conclusion is that the group which is in the bright blue, so the combination group, exercise plus chemotherapy, has the best effects. So this clearly shows how important also on tumor growth the combination of medical treatment plus exercise is. So exercise in preclinical studies has an impact on tumor growth. And of course, we are asking ourselves, why is it like that? And this is actually my main job. So I'm working on how exercise influences tumor development and tumor growth. And to us, this is so important to understand because from this point on, we can improve exercise recommendations later on. And it should also show you that if you are physically active and if you are exercising, something is moving in your body. And I want to show you just a few examples. So one really important thing, what we also know from preclinical trials, is that we can get more medical treatment, more drug to the tumor tissue. And that makes sense in a way, because if you exercise, you improve vascularization, and you also have an increase in circulation, and thereby you can also bring more therapy to the tumor itself. So that is a direct effect. On the other hand, we know, and this is pretty important, that through exercise we can counteract inflammation. And inflammation is a key driver not only for the development of tumor disease, but also for the development of many other diseases. And the interesting thing is that increased levels of inflammation in your body are not only associated with tumor progress and tumor development, they are also associated with side effects. So what I want to show you here is that exercise can impact this inflammatory process on two levels. We have a direct effect, and this is what is shown on the figure on the left-hand side. You can see here that physical exercise provokes a short-term pro-inflammatory environment. So you can imagine a short-term exercise increases your inflammatory environment, but this is followed by a long-term or mid-term anti-inflammatory process. And we know these days that we can increase cells which are producing these anti-inflammatory products through exercise on the long term. And this is pretty interesting, as I've mentioned, not only for tumor patients, but also for many other diseases. So this is the direct effect. And on the other hand, we have an indirect effect, which is not only related to exercise, but as you can see here, also related to nutrition or to drinking. I've just put here the beer belly, a pretty common thing in Germany, but maybe also in UK. And what we see here is that adipose tissue, especially visceral adipose tissue, which is a major source of inflammatory markers or inflammatory hormones, can be reduced through exercise. So if you exercise a little bit more, that contributes to a loss of fat tissue or adipose tissue, and thereby you can decrease inflammation as well. Apart from inflammation, we also can affect or impact the immune system. And this is so interesting because immunotherapies are pretty new in cancer treatment. And interestingly, exercise has some specific abilities which are pretty common to these immunotherapies right now. So in our body, just to give you one example, we have some cells, some immune cells, which can recognize and eliminate tumor cells. One of these types of cells is called NK cells, or natural killer cells. And you can imagine these cells like a body's own tumor police. And what we know about these cells is that we can mobilize those cells with physical exercise. So if you are physical active, you can bring these cells into circulation. That's nothing new. We know that right now for more than 20 years. But the interesting thing is that these cells immediately after exercise increase in the bloodstream, and then they strongly decrease. So they disappear out of the bloodstream. And for a long time, we were not really sure if this is a good or bad sign. But we know today from really nice preclinical studies that these cells do not die. They just go out of the bloodstream, and in fact, they strongly accumulate within tumor tissue. So they are looking for the way to the tumor, and exercise improves this looking for the tumor and improves the migration of these cells to the tumor. So to sum that up, we know that we can give our tumor police a faster car, which brings our police much closer to the enemy, to the tumor. And this is a really positive effect, and this is right now really evident. So we know that is true. And the interesting thing is that we know from human studies that the number of these natural killer cells within the tumor is directly associated with the prognosis, at least for some types of tumor. Another thing is in the context of these natural killer cells that we not only can bring them faster to the tumor, we can also improve their ability to recognize tumor tissue and to eliminate it. So to stay in this figure or picture with the tumor police, we know that we can mobilize these cells and give them a faster car, but we can also improve their weapons. So thank you very much for watching, and let's get it on. Stay physical active. Thank you.